Namaste and welcome to the next lecture of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Yashtimadu as a Dravya and its clinical application. I have given you homework according to the Gana of the Yashtimadu that it is described Chardi Nigrahana as well as Vamnopaga in Charak Samhita. Now, to exactly opposite, Vamnopaga means which helps uh, vomiting or induces vomiting. Okay, so it is one at one end it is Chhardi Nigrahana. It stops vomiting, and same dravya acting as a Vamnopaga means it helps for the vomiting process. Now, how you will analyze these two different, totally different karma of the same drug? Now, let us discuss one by one. Again, I will repeat Rasapanchak, Madhur Madhurshi, Guru Snigdha. Now, first we will take Chhardi Nigrahana. We have to give Stambhane Himaha. So, Shita Virya, it's directly by Stambhan Karma, it will stop the Chhardi. Also, Madhur Rasa, Madhura Vipak will be helpful in Vataja Chhardi as well as Pittaja Chhardi, because both these Madhur Rasa and Madhur Vipak are Vata Pitta Shamak. If it is Kafaja Chhardi, what you will do, which is really a rare thing. We have seen mainly Chhardi is rare to either Samata or either Pitta Chhardi. But if Pitta Chhardi, you can give it Koshna Jala or with Anupan as a honey or Madhu. So, in this case, we will stop the Chhardi by mainly Shitavirya, Stambhane, Himaha, and the Gati is stopped, the outward, which is Urdhagaman. Now, in the case of Vamnopaga, it helps to the vomiting process. So, in practice also, when we are actually doing Vamana Karma, we give Yashtimadu Kvat and then along with Madanfal, etc. etc. So, in this case, what happens? What is the actual action? That it is Madhura Rasa, Madhura Vipak, it is Snigdha Guna. So, Kledane Snigdha. And in what form we give? It we give in the form of Kvat. So, again, Jala Mahabhut is added. So, Snigdha Gun is again rectified. And in which quantity we give in a large quantity for Vamana. We don't give just 10 ml, 20 ml. We to have to give in the 400, 500, 1 liter in that range. Because when you will give Kvata Kalpana, which is of Jala Pradhan, Jeshtamad, which is also a Snigdha Guna, Jala is also a Snigdha Guna, and in that addition, the quantity is much more than normal Kvat quantity. It all adds to this Snigdha Guna, which is Kledane Snigdha. And that's why this excessive Kledan increases the Kapha dosh, and then it is increased in that much quantity that the body expels that Kapha dosh in the form of Vaman. The same principle is applied when we give dahi a day before the Vamana Prakriya, because that dahi in a good quantity helps to this increase in the Kapha dosh, and it increase in such a quantity that it comes to the Koshtha, because it has to get some area to be acquired, and again next morning this Yashtimudukvat with lot of amount again aggravates this uh, kapha dosh, and it aggravates in such a manner or in a quantity that body expels it outside the body. So same drug having two different phenomena. In Chhardi Nigrahana, we give with honey, we give with as Anupan Grota, and how we give muhur muhur, means a very small quantity, because that muhur muhur action will act on this track where actual gati of dosha is present, and this continuous muhur muhur action helps to stop the chhardi. And in Vamnapaga, you have to give this Yashtimadu in the cause form only, that too in a very large quantity. And again, to have this action, the Purukarma of the patient, that Snehan, Svedan, Dahi Sevan before night, should be properly processed. Otherwise, it will not help, because all this Purukarma has already aggravated the kapha dosh. It has uklishta kapha dosh has uh, come into the koshtha in the amashay, and that uklishta for that uklishta kapha dosh, this Yashtimadu Kvat will help as a trigger, and hence the Vamnapaga action will be seen. So when you are seeing Yashtimadu as a Vamnapaga, always remember that Pura Karma, when I am talking about the Panchakarma at present, as a woman, as a one of the Panchakarma, should be properly done in the patient. Okay? Now, you had got two patients of Chhardi. Let us keep away the Vaman Prakriya as a Panchakarma. Just plain two patients of Chhardi in front of you, to whom you will give as Chhardi Nigrahana, and to whom you will use that Yashtimadu as Vamnopaga. So, when the Chhardi is in a profuse intensity, you are seeing Rasakshay as a Lakshan, patient is Bala, Bhiru, Garbhini, Vruddha, who will not tolerate the further Chhardi Vega. In that case, you have to stop the Chhardi immediately, otherwise Rasakshay or other adverse effect of the Chhardi will be seen. So, in that case, Yashtimadu should be used as a Chhardi Nigrahana in such patients. So, Bala, Vruddha, Bhiru, which are failed of Chhardi, Garbhini, then already patient has having Rasakshaya or Balakshaya. In such all cases, you should stop the Chhardi immediately, and then in that case give Yashtimadu as a muhur muhur with proper anupan, whether it is Gruta, Madhu or Poshnal Jal. Now, when patient is having Chhardi and patient himself tells you that if the material inside the stomach gets expelled out, I will be free. Or when there is Amaja Chhardi, and when the Saman dosha na nirare, or the Sama dosh which are trying to get expelled out of body on their own, help them in the Sutra Bhaya. So, when the patient is Balavan, there is Doshotklishta, natural Doshotlesha, and patient, there is Amar Chhardi, and that Amar is trying to get expelled out of the body. In that case, give Yashtimadu as a Vamnapaga, that it will help that as a trigger, and the Dosho Shodhana will be achieved. So, same drug having two different properties or karma totally depends on the condition of the patient, where it should be used as Chhardi Nigrahana or it should be used as the Vamnapaga. Choice is yours, and that's why to use this dravya by either way, Chhardi Nigrahana or as a Vamnapaga, It totally depends on you, your diagnosis of the patient's condition, and that's why Robert Samhita has said, Sushma Sushma Samishesham Doshaushadha Nirupane, that analyze the patient in detail at the very micro or minute level, then only you will be able to use Dravya like Yashtimadu having two different exactly opposite actions. But if you Sukma Savisheshan Dosho Shodha Nirupane, if you really analyze it in a very properly, acutely, minutely, then only you will be able to use either Chadi Nigrana or Brahmanokal. Enough for today. We will meet next week. Thank you very much.